According to the Indiana State Department of Health, diabetes is a group of diseases resulting in high levels of blood glucose due to the defects in insulin production, action, or both. People who are diabetic can work with their healthcare providers and support systems to control their disease and lower their risk for complications. You or someone you know may be diabetic or might develop diabetes. As a nurse, I have seen many changes in healthcare. One change has been the invention of the insulin pen. The insulin pen makes it easier to give yourself or someone else insulin. After discussing the 5 steps to insulin administration, you will be able to set up a pen and administer insulin with ease, helping you to better control the disease. Let's begin with the first step. The first step is to prepare your pen for use. You will remove the cap. If your insulin is milky, you will gently roll the pen to distribute the insulin and mix it up. If you have clear insulin, this step is not necessary. You will next take your needle and remove the paper and screw the needle into the top of the pen. You will then remove the cap. The next step is to prime your insulin needle. You're going to want to do this because it's going to ensure that all of the air is out of the needle and that you get an accurate insulin dose. In order to prime this, you're going to set your insulin dose to 2 units. Hold your pen upright and depress the dispensing button. You're going to look for a small stream of insulin or a drop of insulin at the top of the needle. If this doesn't happen the first time, you can repeat until you see the stream or the drop. Now that you have your pen set up, the next step is to set your dose. For the sake of this demonstration, we're going to say that your physician would like for you to have 16 units of insulin. You will just simply dial your dose to the number 16. Once you have set your dose, your next step is going to be to choose your site. The most optimal site for giving insulin is in your abdomen. You will want to make sure to stay 3 to 4 inches away from your belly button. You can give in the lower portion, the upper portion, or along the sides. You can also give insulin in the back of the arm and the tops of the thighs. Once you've determined where you're going to give your insulin, your next step is going to be to prepare your site and give the insulin. You'll clean your site after you've chosen it with an alcohol pad. Once the area is dry, you'll gently pinch up the skin. You will then hold your pen at the top, gripping it like so, with your thumb hovering above the dispensing button. You will then press the needle into the skin and press the dispensing button. It will go all the way to 0. You're going to hold your pen in place for a count of 5 to 10 seconds. This will ensure that the insulin will not ooze from the site. Once your count of 10 to 5 seconds is complete, you will remove the needle with one swift motion. Your final step is to then prepare your insulin for the next dose. You will screw off the needle, drop it into a hard container, replace your pen cap. Now that you have learned how to set up your pen, set your dose, choose your injection site, inject your insulin, and then set up your pen for future use, you might find it much easier than the old-fashioned treatment, which required extra equipment. This easier system could help you or a friend or a loved one better control their disease.